Anytime I was 24 hours. Got it. All right, guys. I think it's on there. All right. So I'm gonna have to break down the conduction system part, and then we're gonna go into the mechanical part, and then we'll make sense of this stuff. Okay. All right. So first, let's go over this. So the first thing we're going to cover is going to be a normal sinus rhythm, okay? So that's a normal heartbeat. Normal sinus rhythm is a different way of saying normal heartbeat, okay? Serenity. Do you remember where the electrical activity starts in the heart, in the conduction system? Does anybody recall that? The sinus node. So all of the electricity that makes the heart beat is always going to start, for a normal heart rhythm, is going to start at the SA node, okay? SA node stands for sino-atrial node. It's the atrial node because it's found in the atriums, okay? It's in the top right, it's in the back part of the right atrium. Remember, everything's backwards from talking about sides in the medical field, okay? So go ahead and take that note. So I'll put a note right here for you guys saying this is where electricity starts. I'll keep it simple. I might be wrong. Starts in the heart. All right, and if you guys remember, a heart is like your car. If you have an ignition, a key, you put the key in the ignition, you turn on the car, before the engine comes on, the dashboard lights comes on, right? So the electricity is what makes the car actually, the motor actually start running. Okay, so the electricity is what's going to make these squeeze the blood. Okay, the electricity makes the mechanical part work. All right, so from here, from the SA node, all that electricity is gonna go in two directions. One is gonna shoot straight across immediately, and that's gonna make both of the atriums contract at the same time, okay? So that's that electricity making the mechanical happen. I think the example I use is if you ever got shocked, what happens to your muscle where you got shocked at? It tenses up, right? It twitches. So that's exactly what's happening here. As the electricity is going through the muscle, this is the muscle. The electricity, the wire, it's like wires inside the walls of a house. So the electricity, the wires are going through the muscle as it's passing by, it's twitching. And that's what's making it contract, squeeze that blood. So you guys see the relationship between the electricity and the mechanical part? Okay, good. And then once you guys have that understand this part, this right here is gonna be a no-brainer once I break it down. Okay? Okay, so from the SA node, that electricity is gonna go straight across to the other atrium, and then it's gonna shoot down into the AV node. Okay? And the AV node is the atrial ventricular node. It's called atrial ventricular because it's found between the atrium and the ventricle. That makes sense, right? Kind of. So everything is named after its position. It's named after where it's at. I'll give you guys time for your note a little bit, and then we'll keep going. Let me see, can anybody remember what happens at the AV node? I know it's been a while since we talked about the conduction system, but I'll break it down. So I'll do another note over here for the AV node. Okay, so the AV node, so we're talking about the action of what happens. So at the AV node, electricity, I'm gonna keep it simple. Electricity is temporarily paused. So it holds the electricity right there. It just holds it for a second. Okay? So at the AV node, the electricity is going to fire this way, and that's going to make both of these contract, squeeze the blood. Bam. Okay, electricity. And then while that's happening, the electricity here is just being held on, so it doesn't go down. It doesn't go down to the ventricles. Okay? And we want that to happen. Give you guys a little bit of time. That's super important, and this needs to happen for a reason. So let's actually put it all together right now. Okay. So SA node fires. It fires. Right? It's right here. It fires off this way and this way. So, Jose, when the electricity fires from the SA node, it goes this way and then down here to your AV node. What is that electricity causing these two atriums to do?
It causes the one that goes straight to the other one contracts.
Contracts, right? Because electricity is passing by, so it's going to twitch. So then when they squeeze down, whatever blood is in here will now move where?
To the
What are these called? Remember? That was Monday morning. Ventricles, all right? So do you guys kind of see the tie-in here? A little bit? The electricity is passing by here. It's generated here. It goes straight across. And you guys have all been chalked at one point, I'm pretty sure, right? We've all messed around with electricity when we were little. And that's going to cause the muscle to contract. And so that's going to cause these to squeeze, pushing that blood down. And that's pretty simple, right, Samaj? All right, cool. And then, what did I say happens at the AV node? What happens here? It's a hold, right? It's a hold. It's a temporary hold on the electricity. Okay. Give you guys a little bit of time. Okay. So after this, why do you guys think that we want this hold to happen? Why is that pause so important? No. Anybody else? Do you think it'd be a good idea if all the chambers squeeze at the same time? No, if everything's squeezing at the exact same time, it's like nothing's happening. So what happens, the AV node, that temporary pause that we have right there, that temporary pause is important because it allows for these to squeeze down, right? Because these are being electrocuted in a sense, keeping it simple. And that pause prevents the electricity from going down to the ventricles because that electricity is going to make the ventricles do what? What happens when when you get shocked? Contract, right? So that pause, what it does, it allows the ventricles to just stay relaxed so it can receive that blood. Because if these were squeezing at the same time, nothing's going to happen. That makes sense, right? So that's why that's so important. So that AV hold, the AV node pause or hold allows these to relax so they can actually receive that blood when it's being squeezed down because of the electricity. Okay? So after these have squeezed, that hold is gonna be released. That pause is gonna stop, it's gonna be on pause. So now the electricity is gonna continue down to something called the bundle of His. Okay, from the bundle of His, that electricity, and so this right here where you are seeing the lines, that represents the muscle. And think of these green lines as the wires, like wires that run through the muscle. Just how wires run through the walls, same thing. Everything's the same. Okay? From here, the electricity is going to divide, and it's going to go through the right bundle branch, right here, and the left bundle branch. That's the name down there. And that's how the electricity kind of gets to the bottom of the ventricles and kind of wraps around the ventricles so that then they can squeeze. Still making sense? Okay. And I forgot to put the name for these, but you guys see these little green lines that kind of go out from the bundle branches?
Yeah.
Those are called Purkinje fibers. And what the Purkinje fibers are, think of them as like fingers that wrap around the ventricles, and that's how the electricity gets around all the ventricles. Okay? And then what happens when the electricity gets to the ventricles? What? Contraction, right? Contraction. It's stimulated. Okay, so these are called Purkinje fibers. And my spelling might be wrong, but the information is good. double check the spelling. Purkinje fibers. Okay? Purkinje fibers. So now we know how the electricity, we know what it helps the heart do, right? It just, when the electricity passes, you guys have been shocked before, so you know it's gonna squeeze the muscle. Well, maybe you haven't, but you should know about it. Somebody got shocked that you know. It happens to a lot of people. Okay, so you know what's gonna happen. It's gonna go down. And then one more time, somebody please tell me, what is the AV node? You already told me, so don't tell me. Somebody else besides Samaj tell me, what happens at the AV node? It holds the electricity. Why is that so important?
So they all don't go at once.
So they don't all contract at once, right? Because we want the ventricles to receive that blood. Good, awesome. Okay, so now we know the electricity, what happens, all right, the importance of the AV node hold, and we know what happens mechanically. So we know when that electricity is running through, we know what's happening, right? The squeeze, and now that explains how the blood circulated. How we talked about that before. So now, let's translate all this stuff into how it would look on an EKG machine. So when somebody puts leads on somebody, so a lead, and I'm going to put that right here. So a lead is this, like what you see, right? Also called a lead. But an electrode, see, electrodes are the stickies. I'm just keeping it simple, all right? And then after this, I'll pause the video. We're gonna watch a clip on YouTube on what these are, so you guys can see them, and then where they go. And it'll help you out a little more, and then we can get into this. And it'll help your brain kind of take a little pause from what I'm talking about. So electrodes are the stickies that go on the patient, that allow us to see EKG. Okay, and then it'll make more sense after the video pop up. Yes?
Is that from the sticky pads or
Yeah, the stickies. So at a minimum, as an EMT paramedic, as an EMT, you guys won't be reading them. Even if you can, legally you guys can't interpret them. But if you're a good EMT, someone that's worth good, you're good, you should be able to at least put the stickies on for your paramedic. Your paramedic is gonna lean on you a lot. So if you're out there working as an EMT, a good EMT is really like a good assistant for the paramedic. But being a good assistant for the paramedic is gonna help you learn to become a paramedic, because now they're gonna lean on you for the very basic stuff, and you're gonna learn that stuff. That makes sense, right? Like they said, a good leader is a good follower type of deal. Kind of the same thing. But so the stickies, the electrodes, this is perfect. So at a minimum, you'll have 4, and they'll go right here. Well, they'll go either on the shoulders and down in the pelvic area, or right by the pelvic area. Or if you're using the 4 stickies, the other option, where I've seen it a lot, is they go on the limbs. So some paramedics or EMTs will put the ones that are here on the shoulders, they'll put them on the wrist. Or they'll put them down here in the pelvis too. Yeah, and I'm gonna leave that alone. Okay? But you can put them here, here, here. That's the normal. It depends on where you work at, because I've worked in San Diego and they do it different in Fresno a little bit. But everywhere you go is gonna be a little different, but everything works the same way. Any questions? Nope. All right, I'm gonna pause this so we can watch the video, and then I might get back to this.